Hey, welcome back. You know, hearing loss isn't always something that happens slowly over time. As we get older, some people develop something called sudden deafness. I'd never heard of this one, so I'm going to be learning along with you. Dr. Rebecca Brashears is here, the owner and audiologist with Ascent Audiology and Hearing, to tell us more about it. So,
yes,
sudden deafness.
Yeah, so sudden deafness is also called sudden sensory neural hearing loss.
Okay.
And so it comes on really quickly, so it can happen immediately or over a couple days, and you don't know why it came on. And so many times an individual will wake up in the morning and it'll be that one ear where they're not hearing anymore.
Okay.
Or say later in the day they try to talk on the telephone and then they can't hear.
Right.
You know, it can also be from, you know, when a patient, or I've had patients also tell me they've heard a pop and then they have no hearing in that ear. So typically it affects just one ear, but it can potentially touch two, but most of the time we see the one. And about age 40 to age 50 is about the age range that we see more, but it can affect anyone of any age. And when you have that sudden hearing loss, you might experience some other symptoms like dizziness, fullness, and tinnitus, which is that ringing or buzzing in the ears. So yeah.
So, and this sounds like something a lot of us would put off, thinking, oh, I was in a pool or maybe the shower and I have maybe water in my ear
exactly,
or something, and not get it checked. But how serious is it if we don't get it checked?
It is a medical emergency, so you need to immediately call your doctor, because sometimes it could be wax buildup or a middle ear issue, but you need to rule that out. If you delay treatment, then there's less likely of a chance to save some of that hearing. So those who go within like a 2 to 4 week period of developing it may have a chance of getting a little bit of the hearing back, may not as well. I've had patients come see me and they waited 6 months, and at that point, you know, it's permanent. So
it is. If you wait too long, don't wait for anything.
Exactly.
Especially with your ears.
Right. Yeah.
Okay, so talk a little bit about you say it only typically happens in one ear.
Yes.
And, you know, it would be something you just maybe wake up and it happens there.
Right.
Who should you contact first? Is this something you would go to the emergency room for?
So you need to get a hearing test. So whether if you contact an audiologist, say like me, we'll do the hearing test first, and I'll immediately send you out for a medical evaluation to an otolaryngologist.
Okay.
So they'll do the medical part, send you out for imaging to make sure, you know, nothing real serious is going on. And then they will prescribe you typically corticosteroids, because it kind of helps with that inflammation. But that, again, that 2 to 4 week period, that time frame is really significant. So you need to get that help immediately.
Wow. Okay. Is there an option for someone who has hearing loss in the other ear as well?
Yes. Okay. So we have 2 different systems. So an individual who has a sudden hearing loss where there's no hearing left, and then the other ear is normal, it's called a cross. So that's contralateral routing of the signal. So the individual on their good ear will have something that looks like a hearing aid, but it's actually it's more of a microphone that's picking up, and then the other side you're going to have what's called a transmitter. And so that's going to get all that from that bad side that you're not hearing anything and send it to the other side, the normal hearing ear, without giving them any kind of amplification. Then if you have a hearing loss in both ears, so that one that's pretty much gone, and then hearing loss in the other ear, we have a bicross. So you're actually going to wear a hearing aid on the ear that has the hearing loss, and the side that's pretty much dead and there's no hearing left will have the transmitter. And so it allows you to get sound from all around, going to your better ear. That way, you know, if emergency vehicles coming, you could hear it. You may still have to look around to localize it, but at least you'll know something's coming.
But it's nice to know that there are some treatment options available. We were seeing some pictures of various hearing devices that would help out in that situation.
So definitely we have rechargeable versions of that too. So just like regular hearing aids, the bicross and cross system, we can get rechargeable for patients. So there's a lot of convenient things out there that we can offer to try to help if medical treatment wasn't an option for that particular hearing loss.
Wow. Okay. So don't put it off. If you wake up one morning and you just are not hearing like you should.
Right. Don't put it off. Call either an audiologist or an ear, nose, and throat doctor. Get in right away.
And we've got your number right there. Everyone should write that down to have it almost on speed dial.
There you go.
At this point.
Please give me a call.
Yes, Dr. Brashears, great talking with you.
Very nice talking.